Hi everyone, my name is Dr. Chris Bird. I'm here on behalf of the Coastal Bend COVID-19 Pandemic Task Force to give you your weekly pandemic report. I want to remind everybody that the task force has two objectives. One is to address your concerns and questions about COVID-19, and we do have a weekly question and answer session with the community at 12 o'clock on Fridays. You can catch that on Facebook Live. And the other purpose is to enable evidence-based decision-making on behalf of our local leaders. There's presently several interventions in place to control the spread of COVID-19, and at NUECESknows.com right now, the risk dashboard indicates that we are at high risk. Now, this is one step down from extreme risk, which we've been in for the last several months. So this is the first time since they started issuing this risk dashboard that we've been lower than extreme. So we're still a code orange, but things seem to be moving in the right direction. Everybody's encouraged to get vaccinated. You're encouraged to avoid crowds and gatherings. You're encouraged to wear face coverings and social distance, and you're encouraged to isolate when exposed or symptomatic. There's partial or all remote schooling occurring depending on where you are. And we're in open Texas 100%. Something that I want to point out is that the CDC this week recommended that if you've been vaccinated, it's okay to congregate with other people that have also been vaccinated, or say family members in small gatherings. So if you're a grandparent and you've been fully vaccinated, which means 2 doses, and then 1 week after that second dose, then the CDC says it's okay to visit with your grandchildren in a small setting, not in a huge family reunion, but in a single household sort of setting with your grandchildren and things like that. So far, there's been over 41,000 total confirmed cases of COVID-19 in the Coastal Bend. A confirmed case is one that is confirmed with a gold standard PCR test or one of the other tests combined with a physician's diagnosis. Of those, there's been a lot of recoveries, over 39,000, and there's presently 888 active confirmed cases, which is down 5% over last week. So let's talk about our modeling, and we're addressing a particular question, which is what happens if we all unmask now, or more appropriately, what happens if we just let vaccinations take over to control COVID-19 and we try to go back to normal. In this modeling that we're going to do, we're going to assume that all people who have recovered from COVID are immune, all people who are vaccinated are immune. These are overly optimistic assumptions. We know that this isn't the case, but we're showing you what could happen even in an optimistic scenario if we were to all try to go back to normal. We're going to assume that the transmission rate is not affected by new variants, and we know that it is. And we're going to also assume that there can be up to 30,000 new vaccinations per week in the Coastal Bend. As far as I know at this point in time, we haven't come within 50% of that. And this would be first vaccinations. And additional assumptions are that there are no other mitigations. So we're wondering what would happen if we go back to normal, and we'll compare that to what our actual projection is. Okay, so in blue is our actual projection. It's a fit to the data. So that's the fit of our model. The graph is of transmission rate. So if one person on average that gets COVID transmits it to one more person on average, that's a transmission rate of 1. If they transmit it to more than one person, then COVID spreads, and that's what would be projected to occur if we try to rely only on vaccinations to control COVID starting on March 10th, which is when the statewide mask order was lifted. Under that scenario, if we all try to go back to normal, the transmission rate could rise to 1.9 or even higher. Remember that the conditions that we assumed here are extremely optimistic, and unlikely. Now, I also know that it's unlikely that we're all going to try to go back to normal, but I think it's important to know at what point we're not projected to have a large spike in transmission rate again, because then that means that we can probably actually go back to normal. So what does this look like when we turn it into number of new cases? The black points are the number of new cases per day in the coastal bend. The blue line here is our projection, and there's a blue line under the orange line there too, which is the scenario where only mitigations, or the only mitigation is vaccinations. And you can see that there's, again, a very steep increase in the number of confirmed COVID cases if we try to go back to normal, making optimistic assumptions about the level of immunity in the community. Overall, we have a decline in the number of new cases. The transmission rate's below 1, so that's a good thing. But we need to stay vigilant, otherwise the transmission rate can go well above 1 and we can end up in another surge of COVID. Looking at the data county by county for the coastal bend, there's more new cases in NUECES than the other counties. That's typical because NUECES is the biggest county in the coastal bend. Last week we were on this increasing trajectory, but since then we've been on a decreasing trajectory again, hence this overall declining trend over the past month as well as the past week, putting us on this transmission rate below 1, which means COVID is contracting. In the rest of the coastal bend, there's a low level of cases. We're not going to expand this week because it looks very confusing. Just realize that there's not very many cases in the other counties of the coastal bend. When we zoom out to look at the whole state, what we see is we're declining across Texas off of the winter and fall peaks. There are some public health regions. That's what each of these sections of Texas are. They're different public health regions. In Houston, it looks like it's kind of leveling off and maybe even increasing a little bit. Some of these other places, Longview, leveling off, Amarillo, San Antonio, are on their way down or leveling off. So there's a continued decrease, and hopefully it continues to go lower and we can get to where we were before June in 2020. In terms of hospitalizations, right now the black data points again are the actual number of COVID patients that are in our coastal bend hospitals each day. If you're in the hospital with COVID for 2 days in a row, you'd be counted once on the first day, you'd be counted once again on the second day. So that's why we call it the census of COVID inpatients. You can see that it's leveled off in the past week. And we've seen this occur before. We saw this in the fall after the summer peak. And while I don't know if anybody remembers, but the projection went well below the actual number of people with COVID in hospital, that seems to be starting to occur again. And it's at about the same number of patients, right around 100. My hypothesis on this is that at some point, because there's more room in the hospital, that people with less severe symptoms are admitted. That would explain what happened before, and it could explain what we're seeing right now with about the same amount, with about the same census over the past week or even several weeks. So the question is, are we leveling off or are we continuing to decline? And we'll see in the future. Again, if we were to go to a scenario where we tried to go back to normal, let vaccinations take care of COVID, we would go through another spike because there's not enough people that will have been vaccinated in this time period, given our assumptions in the amount of vaccinations that will be delivered in that time period. Moving on to the ICU, and it's important because the ICU is the part of the hospital that seems to get the most strained by COVID. You can see in the summer spike, there were more COVID patients than there were normally ICU patients overall. That's what this blue line represents, was the mean number of patients in the ICU in the coastal bend before the pandemic started. So we're just continuing that blue line across. You can see now that we're down well off that peak. There's still 27 people with COVID in the ICU as of March 10th, with 161 people that don't have COVID. What this means is that we're able to provide this intensive care to not just people with COVID, but people with other intensive care needs. That's the important thing, and we want to keep our hospitals free to deal with the typical amount of people that need intensive care. And right now, with 161 compared to the 150 average, we're achieving that. So this plot is for one day. It's like the last plot. It's COVID patients in red versus non-COVID patients in blue. And the skies haven't looked so blue on this plot since we started showing it. So this shows the level of pressure that's being applied to ICUs across Texas by trauma service area. The more blue, the less pressure. And right now you can see there's a lot of blue. The counties or the trauma service areas with the most pressure are over here in the Lufkin area and in the Victoria area. Okay, so this is looking a lot better than it has. Hopefully this continues to decline. Moving on to fatalities, the dots here represent the average number of fatalities per day from COVID. And you can see the projection in blue is predicting a continued decline. Remember, fatalities follow cases. They lag behind cases, and so we're fairly certain in this projection. What the orange line represents, again, is what could happen if we tried to allow vaccinations to be the only mitigation and we try to go back to normal otherwise, and the fatalities would be projected to increase under that scenario. So overall, we're projecting that there will be a continued decline based upon everything that we see right now, but realize that we're not out of the woods here yet. There's been 1,178 fatalities in the Coastal Bend due to COVID-19 and 730 in NUECES. This data comes from the state of Texas. They count the death certificates that they receive where the primary cause of death is COVID-19. These numbers do lag that of the counties by a day or two, and could even lag by more because it takes the state up to 14 days to process the death certificates. So after you hear about a fatality being announced for NUECES County, it might take up to 14 days before we see it up here in this overall Coastal Bend number. Okay, moving forward to vaccinations, let's talk about something more uplifting and positive, and that's that we're steadily increasing in the number of people vaccinated in the Coastal Bend. This figure is a little bit different than the ones that I've shown for vaccinations in the past. We're looking at how the number of people being fully vaccinated is accumulating, and depending upon which county you look at, you can see, say, for Kennedy County, they really shot up and then have leveled off, but I mean, they're well over 20% of the population of Kennedy has been vaccinated completely. It means both doses of the Moderna or Pfizer vaccine. But we also know that NUECES is one of the largest counties, or is the largest county in the Coastal Bend, is really going to dominate this pattern. And you can see there's this steady increase that we've been seeing in NUECES and several of the other counties in the Coastal Bend. When we put those all together and compare them to the rest of Texas, we can see that about 12% of the Coastal Bend has been fully vaccinated. And this isn't just adults, this is adults and children, because ultimately herd immunity is achieved by the proportion of the population, the whole population, that is vaccinated. And also, we've been steadily rising in relation to the other trauma service areas in Texas, and I believe now we are the second most vaccinated trauma service area in all of Texas. So I think a large amount of credit is due to the organizations, including the Public Health Department, the NUECES Public Health Department, that are vaccinating the people of the Coastal Bend, as well as the people that are getting vaccinated. It's really important that if you're eligible, you should go get vaccinated. Don't wait. This way, we'll vaccinate as many people as fast as we can, and we can finally end this pandemic and the mitigations that we keep having to put in place to control the spread of COVID-19 and make sure that everybody receives the hospital care that they deserve. And while for some of us, our lives may seem more normal than in the past, what I've been hearing from our health professionals is that really they would like a little break here. And so please keep wearing your masks, and please keep social distancing and doing all those things to stop the transmission of COVID-19 so that our healthcare professionals can catch a break, they can get a breather. They've been going for a year straight on COVID now. And any little break that they could get, I'm sure, would raise their spirits. So if for no other reason, think about the people in our community, the doctors and the nurses and everybody that are treating these COVID patients. Lastly, we're bringing back the cell phone metrics because there seems to be an interesting development occurring, and that's that when we look at non-essential visits, these are visits to places other than, say, the grocery store or the home improvement store. These are visits to places that you don't really need to go. They're up at the normal level. And they've been trending in that direction for a little while. Also, people seem to be traveling more than before. So in some ways, the cell phone indices are kind of ringing a little bit of a warning bell here that we want to be careful. But it does seem that based on the level of encounters, which is measured by cell phones coming near each other, and it's estimated or it's compared to where we were before the pandemic started. That's what 100 would mean on the scale, that we're well down about 1/4 of normal in terms of encounters. So hopefully that continues. If you're wondering about the validity of these cell phone metrics, I put in some calibration points for you. The ice storm right here, you can see non-essential visits, distance traveled, and encounters were way down. Christmas, same thing. Thanksgiving, same thing, at least for the non-essential visits and the distance, and the encounters. So I encourage everybody to mask up. It's okay to trigger maybe some increases in some of these cell phone metrics as long as we're doing things like wearing masks and social distancing. So in summary, the transmission rate is 0.92. That means that for every 10 people that get COVID, they pass it on to approximately an additional 9 people. That means COVID is declining. So new cases, hospitalizations, and fatalities seem to be declining, or in the case of hospitalizations, maybe holding steady for COVID patients, but that might mean that COVID patients with less severe symptoms are getting better care. Cell phone metrics are rising. This is something that we want to keep our eyes on because cell phone metrics can predict a potential future rise in transmission rate, and they certainly have for us in the past. And I want to emphasize that we've run a model scenario here that is showing us what can happen if we try to go back to normal. And what happens if we try to go back to normal is that there would be another major outbreak. And so we're not to the point yet where we can take off our masks in public and we can just let the vaccinations do their work. So again, you're encouraged to get vaccinated. You're encouraged to stay vigilant. Make sure that you're wearing your KN95 face mask if you can find one. If not, double up. It's almost as good as a KN95. So if you take one of those surgical masks and combine it with a cotton mask, that can get you up to a 92 on that scale of N95 and KN95, which is very good. Continue to social distance. And remember that multi-household celebrations continue to be discouraged right now. Even though the numbers are down, we want to keep them down, get people vaccinated so that then we can relax and not go through another spike, not pressure our healthcare professionals and the hospital system, and we can start to go on with our lives. All right, so that's the report for this week. I want to thank everybody for tuning in. If you have any questions or comments, we're happy to address those and get back to you. If you hit us up on CBCovid at Twitter, Instagram, Facebook, or YouTube. We have a live question and answer session on Fridays at noon that are broadcast on Facebook Live. You can ask questions at any point during the week. We'll answer all of them during that 12 o'clock noon time frame on the live feed on Facebook. And I think that's everything. I hope everybody has a safe and good weekend, and we'll see you next week. And if there's any major updates, we'll post them to the social media accounts. Thank you, and we'll see you next week.